Okay.
Okay. Assalamualaikum and very good morning to Dr. Bima and all friends. So today we are from Group 1. We would like to present about 6C of caring in nursing and ethic of caring in nursing. So before we start, let me introduce my group member. Okay. We have Nik Kurata Anis Sabrina, Kalim Wajan dengan Muhammad Ilyas Hakim. So our learning outcome is define 6C and ethics meaning, discuss meaning and importance of 6C, explain relationship between 6C and ethic, define example of 6C. Okay, what is 6C? 6C we have a K, compassion, competence, communication, courage and commitment. So let me present to you what is 6C in general meaning. So 6C is a collection of quality and value which all people working in healthcare provider and social care are expected to demonstrate in their personal behavior, their belief and the way they interact with patients at all stages of delivering care and treatment. Thinking of 6C is a handy way to remember that essential value that underpin everything you learn and practice in this field. The purpose of the 6C is to ensure people are looked after with care and compassion by professionals who are competent, communicate well, have the courage to make change that improve care and can deliver the best and commit to delivering this every day. Next. So, ethic of caring in nursing, we have 7 ethics of caring in nursing, which is autonomy, beneficence, justice, non-maleficence, accountability, fidelity, and veracity. So, what is ethic in general? Ethic determines that characteristic of a profession and also called as code of conduct. Nursing ethic provide the professional standard and for nursing activity, which is protect the nurse and the patient from legal and ethic issue. Ethic are determined standard rules or principles that govern right things. Next. So, as I mentioned just now, that we have a component in 6C. So let me tell you what the meaning of every C one by one. So first is care. Care is the provision of what is necessary for the health, welfare, maintenance, and protection of patient. So obviously, this represents the care and support provision, but it is also something that every individual must display in their action. It is also important to remember that people receiving care will have different needs and expectations at different stages of their life. And so it is necessary for healthcare providers to continually adapt their thinking about what quality care is. Okay, next is compassion. Compassion is empathy, respect, and dignity from the foundation of the relationship that nurses develop with their patient. It is crucial to how people see their care and can also be referred to as informed kindness. So, competence is how care is given through relationship based on empathy, sympathy, respect, and dignity. It can also be described as intelligent kindness and is central to how people perceive their care. Next is competence. The ability to do something well. Nurses are capable of performing a task or job effectively. Competence can include the knowledge and skill. So, let me elaborate the competence. Competence describe our abilities, skill, and knowledge. This covers an understanding of everything to do with the patient, including their mental, emotional health, and their physical condition. It also means and knowledge of all available treatments and making the right choice based on research and evidence. An important point to remember about professional competence is that it changes and evolves throughout our career, so our competence must be continually nurtured. We need to keep learning and practicing in order to maintain the highest standards. So, okay, Anis.
Okay, thank you, Mashita. So now I'm going to present about the importance. First, care. Care helps nurses to develop empathy, sympathy, and establish a relationship with people. This
Duduk sini, tak nampak.
This helps this can help the patient and family achieve a positive outcome and build a good relationship or a rapport with the patient and help the nurses to understand the patient better. Being nurse not only give patient medical treatment, it also acknowledge patient feelings and condition, give advice to patient and help them recovery faster. So next, compassion. Compassion helps nurses understand patient needs better, provide patient with emotional support and the confidence to fight the disease. Showing compassion offer calmness and relief to the patient. It will benefit patient with decreased anxiety, lower blood pressure, and reduce pain and shorter the hospital stays. Next, competence. Competence allows nurses to know what exactly to expected of them and how the nurses should accomplish their task. The nurses need to practice critical thinking when give treatment to the patient and use a correct nursing skill that meets the needs of patient care. The next, relationship with ethics. Care, beneficence, justice, non-maleficence. Compassion, justice, accountability, next, competence, fidelity and veracity. So first I'm going to talk about care. Care relationship with beneficence. Minimize harm and do good to patient. For example, the nurses care to the patient health and recovery by do the 3 times checking and practice the 6 right before giving medication. Non-maleficent. The obligation of nurses not to harm patient. For example, the nurses should advise to the doctor or patient to stop use a medication that harmful to the patient or refusing to give medication if it's not proven to be effective. Justice. Every healthcare professional needs to care to the patient with sympathy and empathy fairly without any judgment. So next ethic, compassion. Relationship with justice. The nurses need to show compassion such as kindness, offer help or give emotional support to every patient regardless patient age, religion, social status or gender. For example, rich and poor patient, regardless their social status, must give fair treatment. Compassion. Next, accountability. The nurses need to be responsible on everything that they do. For example, it is nurses' responsibility to keep the patient's secret without sharing it to other people. Next ethic is competence, the relationship with veracity and fidelity. So first, veracity. Nurses need to have a good knowledge to tell patients facts and give them health education to help them decrease their fear about the disease. Next, fidelity. Be honest to patient. Do not give false facts and fake hope to the patient. For example, instead of give fake hope, The nurses need to improve their knowledge and skill and assure them to do their best in order to treat patients. So that's all from me. Now I'm going to pass to Ilyas.
Okay, thank you, Anis. So now I'm going to present about the meaning of the other 6C. We have the communication, courage and commitment. So the first is, what is communication? Communication is central to successful caring relationship and to effective team working. Not only the way we talk, it is also about listening. So it's focusing on our relationship with the patient, with the patient, with healthcare worker, and also with the relatives. Okay, next, what is courage? Courage allows us to do the right thing and speak up when we have concern to the people we care and also to ourselves. Build up personal strength and vision to innovate and embrace new ways of working. So this is about our personal strength. We are being confident. We are being able to do anything with confidence. You know what is actually you are doing. You are brave enough to speak up when it's necessary. Either it's for yourself or for your patient. Okay, next, what is commitment? Commitment refers to not only commitment to patient and seeing their treatment through the end, but providing what they need for them when they need it. Means that it's focusing on giving a good care to our patient. Okay, next. So now I'm going to present about importance of this C for the nurse. First one is communication. It helps nurse to build a good relationship with patient and team worker. Because if we don't have a good communication skill, patient can't tolerate well. Patient can be stubborn, they don't listen to us. And the communication with the healthcare worker also needed, because in the hospital we don't work alone, we work as a team. So it's important to have these communication skills because it helps us to deal with our patient, with healthcare worker, so our job can be done easily. Next, for the courage, it helps nurses to be confident about making the right things and increase personal strength. It's about we being confident of what we did. We have the courage to speak up when it comes to defend ourselves. It's about being strong. For example, someone was arguing with you when you are actually doing the right thing. So this is where you have to be courage to speak up and you have to decide, you have to defend yourself and prove that you are wrong, that you are right. But remember, you can only defend yourself when you are right. Don't defend yourself when you are wrong. Defend when you are right, admit it when you are wrong. So for the last one is commitment. It helps nurses to plan and providing a high quality care to a patient. Means that we are ready for anything that can happen to our patient. When something happens, we find the solution. When patient is having a sudden complication, we find a way to solve it. Fast thinking, we know how to deal with it because it is our job, it is our responsibility in providing a high quality care to our patient. Okay, next, Kalim.
So thank you, Ilyas. So I will present about other 6C relationship with ethics. So first we have communication, autonomy, fidelity and veracity. Second, courage. We have beneficence, justice, and third we have beneficence and non-beneficence. Next. So example of communication, autonomy. The situation is the patient don't want to go to surgery, but the nurse able to use the communication skill to persuade the patient to go to surgery and explain why the patient need to do the surgery. Second is fidelity. The example is the nurse make a fake promise to patients such as to treat the cancer. As we know, the cancer cannot be treated. And next, veracity. The patient have HIV, so we as a nurse need to veracity to tell the truth, even though even make the patient feeling sad. And with the communication, we can comfort the patient and make him calm and accept the disease. So next, example for courage, we have a beneficent. So example for the beneficent, the doctor do dressing to the patient, but the doctor already violate the aseptic technique. So as a nurse need to speed up the doctor to do a correct technique to the patient. Next is justice. Example, the nurse have two patients, poor and rich patient. The nurse need to treat poor patient first because the poor patient need immediate treatment, but the rich patient suddenly ask to have him first. So this is why justice needed. Courage to speed up the why the action of rich patient is not wrong, not right. Okay, so next is example for commitment. Beneficent. The situation is the patient already have the plan, but suddenly the patient have complications such as a fever. So we have initiative to help patient like perform peptic sponging and advise patient to drink a lot of water. Okay. Next, non-beneficent. The situation is the patient has to change their pampers, but the nurse just ignore, and the patient after few hours, the patient asks again to change the pampers, but when nurse want to change the pampers, the patient already have a redness at cranial part. So
This is bad.
this is a bad example for nurse if you don't have a commitment to the patient. So we already harm the patient. Okay. So the conclusion, the 6 C's of nursing are essential value of the principle that guide the nursing profession. They provide a framework for nurse to provide high quality care to the patient and those in the health and social community. By applying the 6 C's of nursing in practice involve taking a holistic approach to care and involving the patient and their family in care planning. Building this skill takes the time and practice, but with the dedication and willingness to learn, and nurse can continue to grow and improve in their profession. Ultimately, putting patient first and striving to provide them with the best care possible is the heart of nursing practice. Okay, thank you.